I can't imagine I was living like that, animalistic. I put everything I had into it. It brought me to my knees. These are a few ways opioid addiction has been described. It's been more than 15 years since overdose deaths involving prescription opioids began to spike in the U.S. It's been almost 10 years since we saw a rapid increase in overdose deaths involving heroin. More than 5 years ago, we began to see significant increases in overdose deaths involving synthetic opioids, mainly fentanyl, and we're not out of the woods yet.
We are seeing a slight decrease in our deaths. I attribute a lot of that to the Narcan that's being administered by both law enforcement, fire, and EMS. Even lay people, many of them are administering Narcan before EMS gets to the scenes. We knew that we needed to sort of stop the bleeding, if you want to use that phrase, but we had to figure out a way to slow the deaths down. And to us, the most effective way to do that, it seemed, was Narcan. August was a rough month. We had 20 plus opioid deaths in August, which was a really difficult month. We try to alert the public when we see a spike like that. If you have a loved one that's a user, please be aware that we're seeing an increase.
I keep on saying, this is not an opioid crisis, this is an addiction crisis. We have to understand that in the totalness of this problem, or we're not going to change anything. Some people will be helped by Suboxone and some of these other things, but that's not the total answer. The total answer is a turnaround in how they're living their life. That takes intervention by people who, A, are knowledgeable, B, care, C, are there and accessible in those times. We can't settle for maintenance of people. We have to shoot for recovery.
Today, healthcare is about empowering people to take control of their health. Whether creating a fitness routine, choosing the right procedures and medications, or adhering to treatment for a chronic condition. Capital Blue Cross, dedicated to underwriting transforming health for the good health of the community. Capital Blue Cross. Live fearless. WellSpan Health, helping patients reach their health goals through a coordinated system of physicians, hospitals, and convenient healthcare services in communities across central Pennsylvania. Learn more at wellspan.org. WellSpan Health, for the journey that is life. Support also comes from viewers like you. Thank you.
Hello and welcome to Transforming Health, Recovery is Possible. I'm Kira McGuire. We hear about tragic losses connected to the opioid epidemic on social media, in the paper, on the news. What we don't hear about is the growing recovery community, the people who know firsthand what addiction feels like, how many times it might take to get clean, how overwhelming it can be to come out of treatment and pick up the pieces. There was a time when it was hard to find people to talk about addiction. But today, the recovery community in Pennsylvania is strong. People in long-term recovery want to share their stories to help others reach and stay in recovery.
So I started shooting heroin around 13.
In 2001, I was introduced to OxyContin. By 2002, I was doing heroin.
I started taking pills, and before I knew it, I was addicted to them.
My first experience with drugs altogether was a little prescription from my doctor.
After a while, pills were just too expensive and too hard to come by, and then obviously heroin became the easier target for me to get.
As soon as I experienced heroin, there was no turning back.
That was my escape from the world.
I remember doing heroin and thinking, like, this is it. Like, I will never do anything else. This is all I want to ever do.
That was it. Everything consisted of getting that drug. Risky behavior, jail, a lot of incarcerations.
It affected everything. It affected my relationships with my family, my relationships with my peers.
It started being a way of life. It was a lifestyle that I had created for myself.
I've had 8 incarcerations.
I used while I was pregnant.
I was left all alone.
I mean, really just started living at like an animalistic level. Overdosing became part of it.
I counted 30. That was with Narcan. At one point, it was kind of like I wanted to die because it would have been easier on everybody, and including me.
My name is Matt, and I'm a person in long-term recovery. And what that means is I haven't used a drink or a drug since November 9th, 2009.
I'm Alex. I've been in long-term recovery since September 9th, 2016.
August 11, 2016.
January 19, 2010.
September 3rd, 2004.
November 4th, 2013.
January 11th, 2014.
April 30th, 2017. I started listening to people that were real about their stories and raw about their experience. And I met a gentleman named Chris, who I kind of listened to what he did and watched the way he acted.
I work at a treatment center, and like I see people from the recovering community come in on a daily basis and like sit down with somebody and they have that truth discussion, right? And for the first time, that other person sees that somebody else understands exactly what they're talking about, and as soon as they see that, something clicks, and then recovery begins, man. So when I met Dan, we just kind of sat down and we discussed the truth.
Dan had reached out to me after I got clean and I was out of rehab and said, hey, look, I'm starting this thing. I'm doing this 100%. I'd like you to help out.
I met this guy, Cecil, and I mean, literally, this guy would come and pick me up every day from treatment at 5 o'clock, and he introduced me to recovery, showed me what it was about, introduced me to people that I'm still friends with today, and really just showed me that there was a life beyond getting high.
You know, he says that I have a role in his recovery, but he has a role in my recovery as well. And I told him, I said, you know what? If I can do it, you can do it. And we formed a relationship at that point.
Matt coming in and sitting down with me and just, I mean, we would listen to music and just talk. For the first time, somebody was that understood my pathway was there. He showed me what it was like to be there for somebody else. You know, okay, I'm done work at this time, I'm gonna pick you up and I'm gonna take you here.
There are some people whose spirits we just connect to.
I think the recovery community is booming.
I think the biggest thing for me is that like I finally found like a place that I feel a part of something.
I think the best way I've ever heard it described, it's like a shipwreck, right? Like everybody, you know, on the shipwreck, you survive, right? And everybody goes their separate ways after, but like you put them in a room together, it's like, oh my God, it's so good to see you. It's so good to see how you're doing. You know what I mean? Like that love is something that it's very rare to find in other places. And that's something that just exists with us.
The fact that there were people there when I came in to help me is what makes it important for me to stay. Because if we all got better and left, well, who would be there for the ones that are coming in next?
For somebody that's just coming in, we are imperative. I mean, we set the example. So that's why it's important when you're new coming in the doors is to sit down, close this, open these, and sit and listen and watch. And you'll find somebody in there that makes sense to you, and that's who you gravitate to.
In our process of struggling, there's been one or two people that were there for us, that loved us until we can learn how to love ourselves. And what we do is we try to pay it forward by doing the same thing. The more I do for others, the more it fills my spirit. And the more I stay connected, the more it keeps me grounded and keeps me in the recovery community.
Life is really a blessing, right? Because, I mean, after sitting and thinking about all the things that I've been through and all the different situations that I've been around, I shouldn't be here.
I feel like this is my purpose. I feel like I'm alive for a reason. I dodged many bullets, and I've been kept alive because of the fact that I'm meant to be here to inspire and create change for someone else. There is hope, and recovery is possible.
The big thing is that we do recover.
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 Most people hope to find something they're passionate about in life, but when you come out of recovery and try to start over, it can feel overwhelming. Our next story focuses on a woman who has taken her journey with addiction and turned it into a passionate effort to help others get back on their feet.
Hi, my name's Jan. I'm a woman in long-term recovery, and what that means is that I have not had a drug or a drink in over 10 years. I started young, marijuana, and then to cocaine and hallucinogenics and all kinds of stuff. Nobody starts out wanting to be an addict, and when you first start, you get that feeling of euphoria and you just feel good and your troubles seem to drift away. And the more you need, the more you've become addicted, the more it rules you and you don't rule it. So then it becomes, you know, a need and not a want, and a chore and a job, really, to continue to use. It's, you know, trying to fill that hole in us that, you know, we feel like we're empty. Whatever made the hole for whatever reason, but we're always trying to fill it with something. I was more of a cocaine user, but a drug is a drug is a drug. Like, it affects us all the same and taking us out of ourselves. I pretty much lost everything. I ended up inheriting a house and in my early recovery, and I knew the moment that I had been placed on the will to inherit this house, that that's what I was going to do, was turn it into a recovery house. I just felt like I had to give back and start helping other people that were coming up through the process. Most of the women that come to me, it's opiates that ruled their lives. A lot of these women were in long-term use of heroin, and you know, how it affected them physically and emotionally, mentally. You know, you see the ravages and the scars that it leaves, because when you're under that influence, you will do anything. Every recovery house is different in how it's run. I'm probably the only one in the area where I live with the ladies, and I try to make it more of a home atmosphere. You know, we have pets. You know, we will sit down and eat meals together and cook together. You know, they have rules. They do pay rent. A lot of people will relapse because they get overwhelmed at all they feel like they have to do. Because if you look at the big picture, well, they need a car. Well, I need to get my kids back. I need to get an apartment. I need to get a job. And, you know, it's just, it becomes overwhelming for them. So a lot of times, you know, you have to just kind of pull them back and be like, look, you've already done this, this, and this. You know, like, you're working towards it. You know, you're going in the right direction. Well, it's just about time. We're getting ready to open. We always have the coffee on. The coffee shop is manned completely by volunteers, so, and 7 days a week, from noon until 11 o'clock at night. It gives, you know, everybody a place to go, a safe environment. We hold 12-step meetings here. We have education going on. You know, it's nice that we support all kinds of recovery. So our motto here is, you never have to be alone. A lot of times, you know, in active addiction, we feel very isolated because, you know, what the addiction has done to our friendships, to our personal relationships with family, and just using, period, you tend to isolate. So you don't have to do that here. When somebody walks in the door, you know, we're like, hey, how are you? Come on in. You need a cup of coffee? You know, and just to be able to sit and talk with them. You know, maybe they're hurting that day. But once you get in here and you start to meet people, you kind of realize, like, oh, there is life, you know, after addiction. And it's right here.
People in long-term recovery prove every day that it is possible to find meaning and joy in life after addiction, even to live a life beyond your wildest dreams.
I first got introduced to opiates when I was like 14 years old. The first prescription drug that I remember taking of an opioid would be Vicodin. That quickly spiraled out of control. I got to the point in my addiction where I didn't have access to prescription drugs. They actually became harder to get, but heroin was much cheaper and it was everywhere. That obsession was just above all, and that was my mission, and that's what I would do, and I wouldn't stop until I could get heroin. When I hit my bottom a little over 3 years ago, I was just absolutely insane. Depression that was overwhelming. I was suicidal, but I did not have the courage to carry out the act to end my life, but I felt that I was dead inside. It just all hit. Like I had a moment of desperation, like that I can't go on like this. I had no other option but to take myself to urgent care. I walked in and just explained where I was mentally, physically, what my thoughts were, how I felt, how I didn't want to live anymore. And a social worker came in and she questioned me, and for some reason, for the first time, I think out of desperation, I was honest about my drug use. She actually looked at me and just said, you know, you're an addict and we're gonna get you into treatment. Finally, when I got there, I was surrounded by people who understood me for the first time, you know, because I would always tell myself during active addiction, like, no one understands and no one gets what's going on up here, you know. I was just floored by the amount of patients that were there for opioids strictly, and a lot of them were there for their, you know, multiple times to try and kick the opioid addiction. I just did not realize how huge and widespread it is until then. I got to work through all this trauma that I had never faced head on since I was a child. I got to learn like how to be present. Like that was huge for me. Like I was always in active addiction, like condemning my future, like remembering like bad things and then, you know, ruining the present moment because I couldn't ever enjoy anything or just be here. Each person in recovery, I feel, is just a little notch in the huge, it's just something amazing that's happening.
Hi, I'm Emily Hogarth, and I've been clean since August 19th, 2016. I was introduced to opiates my sophomore year in high school, and then by the end of my senior year, I was like fully addicted. It went downhill fast. Like once I started shooting it, there was no turning back. And I just put everything I had into it. I was living in my ex-boyfriend's dad's car in his garage. I was couch surfing. I was staying at my drug dealer's house. I started selling it. It was bad. I can't imagine that I was living like that, like animalistic. It was just awful. I just realized that I was tired of going to rehab. I was tired of packing up everything that I owned to go to this place for 30 days, and I just realized that I was wasting my life.
Hi, I'm Mark. I'm an addict, and I have not used a drug or a drink since May 19th, 2014. I started smoking weed probably at 14 or 15, you know, cigarettes too, and I came to senior year and tore my ACL. That sent me to the emergency room. I had to get surgery, and I was prescribed pain medicine afterwards, and that sort of opened up a bigger door for using, and it kind of left a big hole inside of me. So I eventually found heroin, and definitely, like, you know, that's kind of what brought me to my knees. That was like almost the end of my road. There really wasn't much else I wanted to do besides use heroin once I found heroin. I remember growing up always like not being able to tell people how I felt, or like maybe I wouldn't tell them how I felt just because I thought they wouldn't understand. It made me feel like very calm, and it made me feel like I didn't care about anything. I went to jail, Dauphin County Prison, for about a year. You're obviously in one place for a long time, and then you get out and there's so much else moving around you. What do? The only thing I did was what I did before I got there, and that was really the only thing I knew how to do. I ended up having to go to the hospital twice in one night, and I vividly remember that. I remember how I felt, and I remember leaving the hospital twice. Those 2 times I was there, I just ripped my IVs out and just walked home. And the next day, I showed up at treatment. It was my parents' choice. I wasn't aware of what was going on because I was basically blacked out and overdosing. I basically came to at treatment, and then I realized I was there, and I was very mad. I didn't really feel like around most people that I fit in, but those were definitely my people, and they pretty much loved me back to life. I met Emily at a meeting.
I actually met him at a meeting, and I knew him for a while, but I never really liked him because he had a mohawk, and I didn't like his lip ring.
I actually found enough courage to go up to say hi to her. She's cute. She's a little bit more reserved than me. I'm a lot more social and open, and there's a good mix between me and her.
And then he messaged me, and we started dating shortly after that. What I love about him now is that he's so supportive, and he has more clean time than I do. So if I'm struggling, he gives me a lot of courage and wisdom, and just what his experience was and how he got through those things that I struggle with.
I proposed to her in Inner Harbor in Baltimore, and I think she saw it coming, but I got down on one knee and I was like, "Will you be my wife?" And she said yes.
It was so sweet. When I found out I was pregnant, I was terrified. My son's name is Callias James Hogarth. The James is after my brother. I feel more fulfilled now that I have him. I don't know, he's just perfect, and I couldn't imagine life without him.
I definitely feel like it's my duty and responsibility now that I am clean to help other people.
If I didn't have those people in the beginning, I wouldn't be here. I'd probably be dead.
It's kind of just so implemented in my mind that I am responsible to help anyone who's sick and suffering anywhere, anytime.
I know sharing my story may feel a little uncomfortable for me at times, but I've been doing it consistently for the past 5 years, and it's kept me clean, and it's helped a lot of people, and it's helped me more. I'm starting to see what they said to me in the beginning of my journey, being clean, that you'll have a life beyond your wildest dreams, because there's no way I could have ever thought that this was possible. This is just the best life's been. I can tell you, I definitely sold myself short. I didn't think I would be married, have a loving wife and a new baby boy, let alone a car, a license, a place to live. All of the stuff that I have today is just completely a miracle.
They say it's like a life beyond your wildest dreams, and that's what it is. I never thought I'd get married. I never thought I'd have a son. I never thought I'd be living on my own and having a job that I actually enjoy. It's beyond my wildest dreams, and I'm sure it's going to get much better from here.
It is beyond my wildest dreams. It truly is. And that's something that I got told that would happen in the beginning. And I remember just doubting that statement and being like, what's that even mean? Does that mean nice cars, lots of money, big family? But it's really none of those things for me. I've gotten to just this place of at peace inside, and this serenity, and this just, I'm okay. And that is enough for me. That is more than I ever could have bargained for.
If you need help or you're worried about a friend or loved one, contact the Substance Abuse and Mental Health Services Administration's National Helpline at 1-800-662-HELP. It's a treatment and referral information service that's free, confidential, and available 24/7, 365 days a year. I'd like to thank all of our guests for being so open and honest with their experiences and for the important work they're doing within our communities. Please join us next time as we continue to share stories and transform health. I'm Kiera McGuire. Thanks for watching.
Today, healthcare is about empowering people to take control of their health. Whether creating a fitness routine, choosing the right procedures and medications, or adhering to treatment for a chronic condition. Capital Blue Cross, dedicated to underwriting transforming health for the good health of the community. Capital Blue Cross. Live fearless. WellSpan Health, helping patients reach their health goals through a coordinated system of physicians, hospitals, and convenient healthcare services in communities across central Pennsylvania. Learn more at wellspan.org. WellSpan Health, for the journey that is life. Support also comes from viewers like you. Thank you.